Hello, good afternoon, everyone. We are back again on our mini live session prior to our webinars. So this month we have Dr. Lim will be sharing about why am I seeing so many mosquitoes? I think a lot of people out there would have this definition of seeing a lot of mosquitoes, especially when they look at the blank areas and white wall and things like that. So we will have Dr. Lim to share a bit more. Okay, what is this? Mosquitoes is actually the right term to use as well. Okay, so hi, Dr. Lim.
Hi, hello everyone.
Hi, Dr. Lim.
Thanks for
Okay,
having us.
thank you for having you here. So, Dr. Lim, so it has been a lot of people would have said that, I've been seeing, I think it's a common thing for you that patient will come to you, I see mosquitoes.
Yes,
You
yes.
know, like they were actually seeing black spots around, flying around or moving around, which sometimes they say it looks like a fly or mosquitoes and that.
Correct.
You know, would actually this affect their daily activities, or should we say what is the actual definition of this mosquitoes term as?
Okay. This complaint of seeing mosquitoes. Yes, actually, I see this. I see quite a few of these cases on the day. Consider an eye disease. Rather, I would say that this is actually a natural phenomenon, and it's actually mainly age related. So these mosquitoes are actually what happened is that in your eye, inside your eyeball, we have this jelly. We call it the witch's jelly. So when you're very young, it's really like a really firm ball of jelly. But as your age increases a bit, certain small little areas inside this ball of jelly, they start to liquefy and become liquid. So what you're seeing as those black spots of mosquitoes, they are actually areas of liquefaction or areas of liquid within that vitreous jelly. So when light enters the eye, the light will what do you call it? Will strike on these areas of liquid, and it will cast all these little shadows on your retina. So that's why you see them as so-called mosquitoes. So this is actually not a disease, right? It's actually a normal age-related phenomenon. Now, if you have short-sightedness, uh, usually you will tend to see these floaters. Yes, the correct. I mean, the usual term for this is actually not mosquitoes, but rather floaters. So if you have short-sightedness, you will tend to see these floaters at an earlier age. People without short-sightedness, probably like maybe late 30s or after 40s, they will start to see it. But people with short-sightedness, especially those who have quite high short-sightedness, even in the teenage years or after 20 years old, they may even start to see a few of these floaters.
I see. But will it actually affect, like, their daily activities,
Okay, floaters by itself actually it does not cause any blurring of vision. In fact, if you have floaters and you feel that it has caused blurring of vision, I would say that it's something pathological. So you must get it checked by a doctor because floaters by itself does not cause any blurring of vision. But yes, when it's new, when it's recent, floaters can be quite disturbing to patients because they're not used to it yet. So they may find that these black spots flying across their field of vision can be quite disturbing. Although it doesn't cause any blurring, but it can cause like probably distraction.
Distraction.
Yes, but usually after some time, maybe after a few weeks or maybe after a few months, when they have accustomed to it, most of them they will not complain anymore. They have like sort of learned to ignore it.
Like just now you mentioned, Dr. Lim, that all this due to the vitreous gel actually liquefies, and then that's what we are actually seeing. Will it actually further? Is this called like it actually like it's part of an aging process as well? I mean, for a normal condition, beside those people who are short-sighted that you mentioned, right? So it's as part of a aging process. But is that something that we should be more take note or alarm? How when should we be alarmed that we have to be extra careful, or we have to come and see a doctor and things like that?
Yes, okay, good question. Actually, as I mentioned earlier, it's not a disease, it's actually a natural phenomenon, a natural age-related phenomenon. But even then, although it's not a disease, yes, sometimes it can cause problems, it can cause actual problems in the eye. So sometimes when this vitreous jelly starts to degenerate and liquefy, it can actually, there's a small percentage chance of it causing a tear or a hole in your retina. So a tear or a hole in the retina, if not treated, there is a high risk of leading to a retinal detachment. So that's one of the things that you should actually check for whenever anyone has a new onset of floaters. They must see a doctor to get a proper complete check to just to make sure that this degeneration of the vitreous jelly has not caused any retinal tears or holes.
To rule it out lah.
Yes, to rule it out. And as I mentioned just now, also if your floaters are associated with blurring of vision, then you definitely must get it checked because floaters normally do not cause any blurring of vision. If there's blurring of vision, then there could be some other issue going on. Now, there are some other pathological causes of floaters. Floaters is not only like age-related. Sometimes if you have bleeding inside the eye, for example, a common cause of bleeding in the eye would be diabetes. So sometimes if diabetes has affected the retina, there may be bleeding inside your eye. So this may also present with floaters. Okay, but in this case, the floaters are not areas of liquid in the jelly, but rather probably areas of blood. Could be blood in the vitreous jelly itself. And usually, if you have bleeding in the vitreous jelly, the blood will also obstruct your vision to some extent.
Right.
So you will have blurring of vision along with the floaters.
Right.
Okay. And then sometimes certain eye conditions like inflammation, intraocular inflammation, they can also cause floaters. Yes. So floaters is not always a natural thing. Sometimes there can be an actual disease going on. So whatever it is, you have floaters, I would say you definitely have to get an eye assessment by a doctor.
Okay, so best even in the initial part, we cannot just deem as aging process.
Yes, correct.
But at least we'll have to get it rule out all the possibilities.
Yes, correct.
But I believe Dr. Lim, it's best also you will do a routine check to make sure, like what you've mentioned, there's no hemorrhage or no tear,
Yes, correct.
so to worsen the condition, right?
Yes, of
So
course.
okay, now back to your sharing just now about if there's a hemorrhage or tear, and if let's say or just purely liquefying of the vitreous gel, can these floaters be cured? Can it go away or not permanently?
Okay, floaters, I would say most of the time it does not go away. As I mentioned earlier, as time goes on, most people, they get accustomed to it. So they may perceive it as becoming less or they may actually think that it's gone away because they have accustomed themselves to it. But actually, in actual fact, floaters, they do not go away because as your age increases, the vitreous gel, it continues to what you call degenerate.
Right.
So all this liquefaction will actually increase. So actually, it does not go away. It's just that after some time, most people, they become accustomed to it.
Okay. But if you're seeing more, then it's something like it will be more alarming already, right?
Yes, actually, the important thing is just now I mentioned one of the complications that may happen is actually a retinal tear or a hole in retina. So you sometimes when a retinal tear or hole happens, you may experience a sudden increase in the floaters. So yes, what you should actually observe or watch out for is actually a sudden increase in floaters. Because if suddenly you're seeing a whole new swarm of floaters, this could actually indicate that there is a tear in the retina. Because sometimes when a tear occurs in the retina, blood vessel may become torn as well, and some blood will spill into the vitreous gel, and you can perceive this as a sudden onset of a lot of floaters. So yes, if you are suddenly seeing a lot of floaters, I think you will need to see a doctor again for a reassessment, just to make sure that there are no tears in the retina has happened. And the other thing is sometimes if you have a tear in the retina, another symptom may be that you may experience or you may see flashes of light in the eye. It's just a camera flash going on internally in your eye. So this can be a possible symptom of a retinal tear as well. So similarly, if you have this symptom, you are seeing like flashes of light in the eye, you must also get an eye assessment just to make sure that it's not retinal tear.
Okay. So like Dr. Lim, if there is symptoms like that, and will I get blind, If I have conditions like that, will I get blind?
Okay,
conditions like that?
Floaters by itself, of course, as I mentioned, it doesn't obstruct your vision. But if there are complications from these floaters, complications from the vitreous gel degeneration, that means that a retinal tear has happened. if a retinal tear has happened, you definitely must get it treated. Usually we do laser retinopexy. We actually use laser to seal off the tear. Because if there's a tear in retina and you don't seal it off, there's a high chance that the internal fluid will enter that tear and it goes behind the retina and your whole retina will leave off. It's just what they call retinal detachment. So if there's a tear, if you don't treat it and it leads to a retinal detachment, then of course your vision will be affected. And if it has come to the stage where the retina has detached, you will need surgery. I would say quite major surgery to actually try to put things right.
Okay, we have some audience on in our live session. If you have question, you can actually post your question in the chat, and then we'll get Dr. Lim to address to your questions. All right. So, okay, I think Dr. Lim, you have shared a bit on the my next question. Actually, if like I'm seeing more mosquitoes, will it become more dangerous? Just now you have mentioned it depending on what condition. If it's like retinal tear or hemorrhage, so it's something that is more alarming that the patient will have to come in and get it assessed properly. But will this be able to sort out, or is there any like a treatment or procedure that can be done if let's say there's a retinal tear or hemorrhage like that? Is there a procedure that can be stop the tearing or prevent further leakage?
Okay. So if, as you mentioned, if the floaters are becoming more,
right?
Yes, definitely you should come in for a reassessment just to make sure that it's not a tear,
right?
Especially if the increase in the floater is quite sudden.
Yeah.
Okay, if, as I mentioned just now, if there is a tear, yes, you will need to treat it, and treatment is in the form of actually laser retinopexy. That means we actually use laser to seal off that tear.
Okay.
So if the tear has been sealed off, then the chances of it progressing to become retinal detachment, of course, is very, very much reduced. But if it has already led to the stage of retinal detachment, then you will need to proceed straight to surgery.
Does the laser, is it painful or is it a simple procedure?
Well, it is fairly simple in the sense that you don't have to lie down and get it done. You remain seated. Okay, you can remain seated at the machine, and then the doctor will place a lens, something like a contact lens on the eye, and then the doctor will shine the laser through the lens into the eye.
Okay.
Usually the condition is not the procedure is not painful, but sometimes some patients, they may experience a bit of discomfort during the procedure because the laser, there is a bit of heat generated sometimes.
All right.
But most of the time, I would say in general, it is not painful.
Okay. Unless it's a retinal detachment, then it will definitely need a surgical procedure, right?
Yes, if you have progressed to that stage, then definitely you need to go for surgery.
Okay. Dr. Lim, I have one more question. Like, usually, at what kind of category of people, beside like you are short-sighted and things like that, what kind of category of people would get floaters? Or is it because of above certain age onwards they have to like take note? Does it occur to children? Things like that?
Okay, floaters, actually, I would say sooner or later everyone will see some floaters because it is actually a universal thing. It's not a disease, it's actually an age-related thing. So as everybody ages, sooner or later, I would say everyone will see some floaters.
Right.
And as I mentioned earlier on, if you happen to be myopic or short-sighted, then it's possible you may start seeing floaters at an earlier age.
Okay.
Because usually people who are short-sighted, the vitreous gel is a bit more, I would say, less firm compared to people without short-sightedness. So if the vitreous gel is less firm, it tends to undergo liquefaction earlier. So like sometimes if you have people who are very highly short-sighted, it's not surprising that sometimes even in the teenage years or like after 20 years, they will see some floaters already.
All right. Okay. All right. So, okay, I think maybe there are a lot of people out there, they don't understand what is floaters or mosquitoes. In Cantonese, we call it fei men zeng, like you will see like mosquito. But Dr. Lim, I believe there are some not only like in the black spot, right? Some like hairline moving around and things like that, right?
Yes.
So it comes in many forms and many shapes.
Yes, correct.
So if you see this and you have not seen an eye doctor, please make an appointment to go and see an eye doctor to make sure and rule out whatever problem, underlying problem is not there. So Dr. Lim, if let's say there's a patient who actually been seeing these mosquitoes, for some time, and then they do a thorough check and retina health, everything is actually fine. Is it good that they should come back on a routine basis to make sure that their retina health and whatever just now the possible complications that will happen will be detected at the earlier stage? Would it actually help in this manner?
Yes, actually, if you already have floaters, that means that the vitreous jelly in the eye has already started degenerating and liquefying. So this is actually a continuous process, which will continue on for actually many years. So at the moment, if you have checked with the doctor and at that moment everything is fine, I would still advise you to come in maybe like a half yearly or maybe once a year, because this jelly liquefaction process is ongoing. So there is always, at any time, there is always a possibility that a tear can happen. A tear may happen anytime, you see.
Okay.
Sometimes a tear happens and sometimes the tear does not give rise to any symptoms. It does not. Sometimes a tear will not cause a sudden increase in floaters. It will also not give rise to flashes of light. So it's also a good idea, if you don't have any of these symptoms, it's also a good idea to come in on a regular basis just to check and make sure that there are no undetected retinal tears or asymptomatic tears, as we call them.
Understand that. Come to a very typical Malaysian question for you.
Okay.
Is there any food that we have to keep watch and to reduce so that I will not have this mosquito problem?
Absolutely not. That is definitely not related to food, nor will any kind of food or health supplement help the condition.
So it won't actually help or cause or make it worse?
Yes, it's not related at all to food. The only factor here is actually aging, actually.
Aging.
Aging.
Okay.
I mean,
Because
if you
typically Malaysian will ask a lot. I believe, Dr.
know.
Lim, you will have a lot of this kind of question, right?
Yes.
Is there any food or any supplements I can actually take to reduce or avoid this problem?
Well, scientifically, actually no. But sometimes if you go to like some places, like maybe pharmacies, they may recommend like certain supplements, even certain eye drops. But to be honest, actually none of this has been shown to actually help in this degeneration of the vitreous jelly, actually. So the only thing you do is actually just try to ignore them.
Okay.
And just watch out for those symptoms I mentioned just now, possible tear, retinal tear, which is suddenly a sudden increase in the floaters, or suddenly you're seeing very frequent flashes of light. So these are two things that I think you should actually just watch out for.
Okay. Okay. Thank you very much. I hope it clears a lot of questions or doubts in many of you who have been seeing mosquitoes, or what we call Feimenjeng. I hope Dr. Lim have give you a clearer picture. Now, if you have interest to find out a bit more in depth, we're going to have our webinar on the 25th of November, which is next Thursday at 8:30 p.m. Click the Zoom link in this post and to register for the webinar. Then if you join our Zoom link, you can have the Q&A session. You can ask Dr. Lim's question directly, any matters related with your eye condition. Okay.
Yes.
So for all the attendees, we're actually entitled for a free consultation with Dr. Lim. So please hurry up, register for our next coming webinar session. All right. So thank you, Dr. Lim. Thank you very much. So we will have next 2 more sessions. All right. Dr. Lim will share a bit more, partly related and also other eye diseases, right, Dr. Lim?
Yes, that's right. I'll be talking a bit on other common eye disorders as
so
well.
we will share a bit more on that in our next session. So remember to like our Facebook page, our IG page, as well as our YouTube channel. So for those who did not register for the webinar, we also have a live streaming in our YouTube and as well as our Facebook page. Okay. So thank you, Dr. Lim.
Thank you very much.
Thank you.
Okay, thanks.